think all systems are a go. Okay, so I'm gonna remember to hit record. And actually, before I hit record, I'm gonna make that mask announcement one more time, because recognizing implicit biases in our organizations and our communities is really gonna help us move towards more equitable systems of care for our patients. Implicit biases really impact the decisions that we make. It really can reduce the quality of care that our patients receive. So let's talk about this, let's recognize it, and then see how we can raise the bar. Time has flown, and we are on the second to the last of our brown bag series. Next, or this Wednesday, Nayaboni will be doing a session on communication, and that will conclude our brown bag series. So thank you all for joining us Monday, Wednesday, Fridays, and we will get some information out about how we can provide this series to you in the future. Oh, did I hit record? Yes, I did. Okay, so with that, my name is Mari. I am the director of the South Central AHEC. We are a health workforce development agency. Our mission is promoting health workforce development so that all Alaskans have access to employment and quality healthcare. We are a department of the APCA, the Alaska Primary Care Association, and the APCA's mission is creating healthy communities in Alaska through the support of vibrant and effective community health centers. We are here for the community health centers of Alaska, and it is wonderful to see so many community health centers here on this call today. We have a variety of programming here at the APCA South Central AHEC. I do want to draw your attention to our apprenticeship program because we are currently in the process of launching our 6th apprenticeship cohort for medical assistants, medical admin assistants, electronic health record specialists, coding, billing, billing and coding specialists, and we do also have a community health worker apprenticeship that is, we don't have a current cohort, but we may in the future. And we are taking names for a wait list through the summer, for spring and summer, for a early fall cohort. So if you're interested in apprenticeships, just let us know. Oh, also, I have invited Kathy Caldwell. She is on this call and she is, I think, unmuted. So Kathy has a lot of experience on this topic of implicit bias, and she is ready to chime in and give us some of her thoughts throughout this presentation. So welcome, Kathy.
Well, thank you.
So we are going to launch a poll. I'd like you to do this poll, and as you're doing this poll, I know we're talking about implicit bias, but just answer it from your conscious mind. This is not an implicit bias test, it's just a poll. Answer it from just how you truly believe. And I can't see it, so can somebody just confirm that they see the poll?
I see it, Mari.
Okay, thank you. Okay. So the question is, which racial group do you believe to be more American? Asian Americans or Euro Americans? So your choices are Euro Americans are more American, Asian Americans are more foreign, neither are more or less American or foreign. Finally, Asian Americans are more American and Euro Americans are more foreign, or this question is silly and I have no idea how to answer it. Just gonna give a few minutes. 68% have voted, so let's give a few more seconds to see if we can get a couple more people to vote in this poll. Okay. All right, so we're going to talk about the results of this poll a little bit later. In the meantime, I want to introduce the topic of bias. So although a bias is often used in a negative context, the word bias simply means evaluation or belief. So which is best, a Vegas vacation, a beach vacation, or a camping vacation? So my bias is probably going to be for a beach vacation. I might even have a bias against a Vegas vacation, and I might be neutral about a camping vacation. So those are just my preferences, and me gravitating towards a beach vacation doesn't make me a bad person. It doesn't really say anything about me or my personality. Explicit means clear and plain. Implicit means that it's sort of underneath the surface, right? So it's understood, though not directly stated. So explicit bias requires that a person is aware of his or her evaluation of a group. They believe that evaluation to be correct in some manner. So some examples of explicit bias can be racism, sexism, other isms, etc. Whereas implicit bias operates in an unintentional, even unconscious manner. So this type of bias doesn't require the perceiver to endorse it or even devote attention to it because they don't know that it's there. Therefore, it's more persistent, it's more common than explicit bias. So when we say that our psychological processes are implicit, we're referring to something outside of our conscious awareness. And we do rely on these implicit processes to get ourselves through efficiently in the world. And so, you know, I didn't do anything to consciously control my preference. And as a side note, implicit bias does not refer to beliefs that we actually consciously have, but we're hiding in order to appear a certain way. So for the vast majority of us, we wouldn't say that we're biased because we're not. Consciously, most of us believe that people are all equal regardless of skin color or sexual orientation, etc. And we hold very ingrained values of equality and freedom. But what does it mean to have thoughts and associations that you're not even aware of? And to illustrate this, we're going to look at some word associations. So in the next slide, I'm going to put up some words, and you're going to, in your mind, complete the pairings. Here we go. Salt and pepper. Night and day. Up and down. So I'm sure for all of us, these answers are completely obvious. And as soon as I put that slide up, you knew what it was automatically without you even having to really think about it. So that is the power of implicit cognition. So when you're faced with information that's not complete, we rely on our associative memory to just very quickly fill in those gaps. So I'm going to give you another example. Read this paragraph. If you can read this paragraph, it's because our minds are very good at putting together pieces of information in a way that is easy for us to make sense of. Our minds do this automatically without our conscious control. So this paragraph is a complete mess, but you were able to read it without any kind of difficulty. It might have taken you a little longer to read, but your unconscious cognition automatically made sense of the paragraph, and that's based on your ability to associate it with all the words that you already know. And what these two exercises demonstrate is that automatic nature of our implicit processing. So when we are faced with ambiguous content or content that's confusing, our brains very quickly try to make sense of it. And we do that by relying on these associations that we've got stored in there in our memory. So what's important is that these stored associations, they don't actually have to be based on accurate logical information. By just seeing concepts grouped together repeatedly, we can internalize associations that are actually inaccurate. So where do our biases come from? So our brain's ability to make connection between two concepts is known as associative learning. And the best example of how our minds do this is through the process of classical conditioning. And one of the the original examples of classical conditioning is the experiment that Pavlov did with his dogs. So dogs salivate when they see food. So Pavlov would ring a bell every time he would give his dogs food. And over time, after seeing those two stimuli paired together repeatedly over and over, the dogs eventually, they would just salivate when a bell was rung, even when there was no food to be had. So that's, forming that association. And we do the same thing when our brains try to perceive and categorize people, where we make an association when something's been paired together over a very long period of time. So, example, if I were to say to you, hey, I recently read a magazine article about a CEO of a big tech company, the automatic picture that you get in your mind, is it of a man or a woman? It might be of a man. And we internalize these associations at a really young age. Our childhood experiences ingrain them in our minds, so that even if we really very firmly believe, which I do, that of course a woman could be the CEO of a tech giant, we're still implicitly influenced by those pairings that our brain has made over and over a long period of time.
And this is Kathy. I'd just like to add here too that oftentimes because of that, we may look around and say, look, all the tech companies have guys as their CEOs, because we see what we expect to see when we have that implicit bias going on.
Thank you. And so no matter how we might love the idea of automatically conjuring a visual image of a female CEO, when we're confronted with the unfamiliar, our stress response kicks in. Our amygdala signals the hypothalamus to fire up the pituitary gland. The pituitary gland releases hormones, and then these hormones travel out of the brain into the adrenal glands, and the adrenal glands release cortisol into the body, which signals the other organs to go into action. And all of this happens in just a second, and it's automatic for us. So it's not our fault, right? We are not off the hook. This stuff matters, and it matters because we don't want to form implicit evaluations based on inaccurate information or stereotypes about people and ideas. There's a lot of evidence that implicit biases can impact our decision making and our behavior, so it is really important to be aware of our implicit biases, especially those that are actually in conflict with what we actually consciously believe. So let's take a minute, let's get to our comment box here. Let's think about how implicit bias can create a barrier to patient care. So go ahead and type some comments into the chat on how implicit bias can create barriers to patient care. And if you want to unmute your mic and just talk, you can do that as well. Not getting a lot of chattiness here. Oh, here we go. We've got Sydney. Unintentionally treating patients differently than one another, even if you would never consciously treat them differently. Exactly. Yes. It may affect communication in the language you use. Thank you. All right. So those are all right on. So, of course, impact on healthcare, patient outcomes are, of course, impacted. And yes, Rhonda, you know, an individual can shut down, exactly. So we can impact the diagnosis that we're making, the interactions we're having with our patients, even how warmly we might treat someone. And then as Rhonda pointed out, that's going to impact how patients are going to perceive the providers. Diana says, by making assumptions about patients and how they're going to react or be compliant or not compliant before you work with them. Yes, and we're going to watch a little video clip that really illustrates that, Diana. So one of the major ways this has been studied and reported is in pain management. It has been shown repeatedly that people with darker skin receive lower dosages of pain medications, and that's across the board, infants to the elderly, and it's because of the assumptions made about addiction or people's ability to be honest about what they are experiencing. So that is, you know, a patient outcome that is greatly impacted. Internal dynamics within organizations. So implicit bias can impact how teams communicate, how they collaborate, who gets promoted. Oh, somebody's saying my sound just went off. Can somebody give me can everybody hear me? Just type yes in the comments. Your sound is working. Okay, yes, thank you. Okay, so how people are promoted within organizations can greatly be impacted. We know there is a gendered pay gap in healthcare. Male nurses make more than female nurses in our country, and this is true in our state. And there was a study published several years ago where researchers created a fictitious resume of an applicant for a lab manager position at the university, and there were two versions. Well, it was basically the same resume was produced, but one had the name Jennifer as the applicant, the other had the name John as the applicant. And the researchers sent over 100 of these resumes out to biologists, chemists, physicists at various academic institutions that were a part of this research study. And these scientists were randomly assigned to either review the Jennifer resume or the John resume. Of course, they were the same exact resume. The result of this study showed that the Jennifer resume was perceived as significantly less competent. So because of that, the scientists in the study were a lot less likely to want to mentor Jennifer and hire her as a lab manager. And the kicker is they also recommended paying her a lower salary. So Jennifer was offered on, this is, you know, hypothetical fictitious Jennifer was offered on average $4,000 a year less than the John resume. That's 13% less. So this is a problem. We also know that there is an economic cost and economic impact of implicit bias. We know that bias costs our healthcare system billions of dollars every year. And if disparities in preventable morbidities and mortalities were to be eliminated, there would be a tremendous cost savings to our overall healthcare system. This is Michelle Van Ryn. She is a researcher at the Mayo Clinic, and this is just a 3-minute video clip illustrating unconscious bias in the healthcare setting and what's being done to address these issues.
The body of evidence is very, very deep, that a lot of what we do is based on very rapid unconscious processes, and that we respond to people very, very quickly without even knowing it, based on years and years of exposure to ideas. So we store ideas together. Let's say a physician walks into the room and the patient is Black, right? And this is a physician who is great, genuinely, consciously unbiased, wants to provide the best care, has very high levels of unconscious racial bias, as do 80% of white Americans. So our physician, our hero, walks in, sees the patient, gets interrupted twice, is worried about another patient, is tired. What happens then is what we all do, is we rely on stored information about the person. We're like, okay, this is what I know about Black people, right? This isn't conscious, less likely to comply, right? These are stereotypes, it's not true. Less intelligent. Without even thinking about it, our hero sits down with good intentions and is already seeing this patient through this framework, the lens, because the unconscious processes are trying to be efficient, like quick, 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 what do we know about Black people? Quick, quick, quick. Maybe eye contact or body language reflects this, right? And now the patient is, a little hesitant, and maybe that hesitation is interpreted in a way that's consistent with the stereotype. We finally got NIH funding to recruit a very large stratified random sample of medical students from 49 schools. In that study, we were actually just looking at the medical school and student factors that affected bias among graduating and new physicians. We have another study right now in the field in which we're trying to prevent any detrimental effects of the experience of race in white medical schools for Black medical students. I believe that healthcare systems are out in front and saying, we're not ignoring this. We know that our intentions are extremely strongly egalitarian. It's part of our principles, but we also know that there's this huge body of work that says maybe sometimes we're not even aware of this. Well, we're going to make sure that we do know.
So what can I do about a bias I don't want? And with all this information that we're discussing, we might think that our biases are too deeply ingrained to change. The good news is that yes, we can hack it. Our brains are malleable. Research is showing that there are ways to lessen the effect of bias or change them altogether over time, but it's going to take work, and I commend all of you for being on this webinar today so that we can hack this. I have this picture, I'm sorry it's such a fuzzy picture, of Dr. Anna from Daniel Tiger's neighborhood, because the other day my twins, I have 7-year-old girl twins, they were talking about how people need to go be seen by a doctor. If people get COVID-19, they're going to go get seen by a doctor or be in the care of a doctor. And I noticed that they were totally, completely unconsciously using the pronoun she to refer to hypothetical physicians. And I just found this so interesting because my unconscious bias, even in this day and age, is probably to the pronoun he. But I am really careful and very conscious of changing that and saying she around my kids when we're talking about physicians, but also airline pilots and truck drivers. And I have a child that wants to be a farmer, so we use the pronoun she. So I am really trying to curate my environment and think in a different way. And of course, Dr. Anna from Daniel Steiger's neighborhood was my kid's first exposure to a physician. And so it's just kind of, we are trying to hack our environment. So the first thing that we want to do to change a bias that we don't want to have is to know our biases. So being consciously aware of our own bias is really, really important, because we can't solve a problem if we don't even know what it is. So, we said over and over, key characteristic of implicit bias is that it is unconscious in nature. And we're not aware of our biases and the way that it impacts others. And the other aspect of this is that it is extremely difficult, if not impossible, to be introspective and look within ourselves to uncover what these implicit biases might be. We can't do it. So there have been tools that have been created to help us measure our implicit biases so that we can better understand them. So one of the most well-known of these assessments is the Harvard Implicit Association test. So this is a behavioral assessment. It's made to created to examine implicit biases. And most of these behavioral assessment tools measure how we process the relationship between concepts. So the underlying assumption is that we're very quick at grouping concepts that are naturally closely related in our minds. So for example, fuzzy little kittens and happiness. There are people out there who hold a negative implicit association with fuzzy kittens, and these tests don't assume a specific association, but they measure the direction and the strengths of these associations. So in other words, the test measures, do I have a positive or a negative association with fuzzy little kittens? And how strong is this feeling? The idea is that concepts that are closely associated are easier to mentally process versus unfamiliar associations that will take longer to process, or we might process them incorrectly. I encourage all of you to go out and take this IAT. It's a great way to identify the biases that we might hold. You might be surprised. Thank you, Nayaboni, for putting it in the chat. It's free. It is available online. It takes about 10 minutes. And so you can see here, there's lots of different IATs: weight, religion, race, etc. And each IAT takes you through a set of trials, and you're asked to make various pairings, and then at the end of that trial, you'll be given information about the strength of your association. Was it strong, moderate, slight, or none? And the IAT is a human assessment, so it is not without any limitations or anything, but this project, Implicit, in and of itself has been studied many times. It has withstood many tests of its reliability and validity, meaning these tests are statistically significant and not simply due to random chance. And it is really fascinating to take this. I've done several myself. I did a couple recently, and it is very, very interesting. Kathy, can you share your experiences and thoughts having taken the IAT? I know you took a couple recently.
Yes. So I've been in the diversity business of helping people understand and become more comfortable with diversity for over 40 years. And the first test I took was one sort of investigating bias towards African American versus Euro American, and I was kind of surprised. It came out that I actually had a slight bias towards African Americans. And I thought about that, and I thought, well, you know, I've been doing a lot of teaching and consciousness raising about things, and so maybe that would make some sense, even though I am Euro-American. So then I decided, well, I'd take one that I didn't spend a lot of time really working with and studying, and so I took the one that looked at religion, and it was primarily looking at the differences between Christianity and Muslim religion. And I found that I was moderately biased towards Christianity. Now, that was an interesting thing for me to think about, because explicitly I think of myself as being a person who is pretty open to all different kinds of religions and so forth. But you know, I grew up in a Christian environment. I grew up in a state that had very little exposure to other faiths. Again, those childhood experiences are so critical, and we don't, and so much of that we don't even realize we're getting. So it surprised me to some degree, but it didn't surprise me in that it made sense to me that there would be a bias there, that then now I can do something about it now. And we'll talk more as Mari goes along with some of the other things we can do to bring that implicit bias into a more of a conscious awareness of it, so we can change it. So but yes, I was intrigued with it. It does make me feel like I want to do some more and sort of see what other things I might be able to find out about myself. A very interesting way of doing it, by looking at speed. And so that was my experience.
Thanks, Kathy. So now I'm going to share the poll that we took at the beginning of this. So again, I can't see it, but I'm assuming that everybody can. I do see in my view here that we have, so can everybody see the results of the poll? Can somebody write yes? And okay, yes, thank you. It's a kind of a funny thing with GoToTraining that I can't see what you all are seeing. But I do know that 65% of you said that neither neither Euro nor Asian Americans are more American or foreign, and 30% of you said this is a silly question. And as an Asian American, thank you for acknowledging that Asian Americans are no more American than European Americans. Now what's interesting, let's look at the results of Project Explicit, the Asian IAT, which addresses this exact question. So do you all see the next slide? Or maybe I need to hide the poll. Hide the poll. Okay. Yes, I'm guessing that everybody's seeing this slide. So over 300,000 individuals took this Asian American IAT test, and it was found that 19% were reported in the neutral category, that is no association between Asian or Euro ethnicity being more American or more foreign, with 63% associating people who are Caucasian with being more American, and 16% associating Asian people with being more American. So that here is the difference between what we believe consciously and what is believed in an implicit association. The next slide here shows the race IAT, and in this implicit association test, you're given pictures of people that are Black and pictures of people that are Caucasian, and you have to associate positive or negative words. You're also given all of these different words that are positive or negative, and you have to make associations, and you have to do it as quickly as you can. And so in this test was taken by over 3 million individuals between December 2002 and December 2015, and 68% of test takers had a Euro-American preference, 18% were neutral, and 14% had an African-American preference. And this data can make us very sad or very angry. We want to see that neutral bar be much, much bigger than 18%, of course. And again, becoming consciously aware of our bias is the first step, because we can't solve a problem unless we know that there is a problem. So we default to automatic processes when we are under stress. So do you have mental fatigue? It could be that we're pulled in multiple directions, or under time pressure, or we haven't had enough sleep, or we're hungry. And during these times, that's when we really need to take a break, pause, reconsider, reflect on our decisions. This is the time that we really need to truly listen to our patients and what people who are different from us are telling us. I heard from Sydney that on Friday, in the caregiver fatigue presentation, that she also talked about mindfulness. Mindfulness is shown by research to be one of the most effective ways of increasing cognitive control. And so it is really going mainstream. It's a technique that helps us sharpen our brains to know what's happening right now in the present, good or bad, noticing our thoughts and emotions without judgment. Mindfulness can also help us align our associations with what we actually believe with those associations. Studies have shown that through a technique where you focus on specific populations, especially marginalized populations, people are actually able to alter their implicit biases. So this is really good news. This means we can do something about our implicit biases through mindfulness practices. By intentionally thinking about marginalized populations in a positive, loving manner. This might sound a little bit like the meta-analysis that was brought up in the previous session. Individuals can increase their empathy and actually decrease the strength of their implicit biases, the ones that we don't want. Kathy, can you give us an example of mindfulness in action?
Yes, so Mari and I had a conversation about some of the stories that have come out, that we are aware of, and I was sharing that because of my work in looking at diversity, I end up in conversations with people all the time, and this was an old conversation with a really dear friend back in California, back in probably 20 years ago, but he made, I don't remember the context exactly, but he made the comment, well, Black people don't own dogs. Absolutely thought that was the oddest thing I'd ever heard, and I questioned him on it and said, well, how do you know that? Well, he said, I've never seen a Black person with a dog, walking a dog or anything, and here he is living in Southern California where you have lots of diversity. So I challenged him to pay attention where lots of people were around their dogs. He took his dog to a dog park and then later reported to me that he was shocked to find how many people of African American descent were in the dog park with their dogs. He was just blown away. And I think that that was such a clear indication to me about how we don't see things how we see what we expect, and we don't see what we don't expect. And before, when he wasn't conscious about it, it just kept adding to his, because he didn't see people walking around with their dogs. He maybe it just added to his sense of implicit bias. Once he brought it to his attention, once he brought it up to his consciousness, he will never again be aware, think that Black people don't have dogs. So that was one story that Mari and I had talked about that we thought I found that to be kind of a very dramatic way of showing. I would never have guessed him to have that kind of a thought. So anyway, that's my story.
Thanks, Kathy. So for organizations, adopting standardized procedures based on data is really important. So we are more likely to rely on stereotypes and implicit association if policies are ambiguous or if they're open to us having to interpret them. So for example, if you have a policy regarding how long a patient, like what you need to do if a patient is waiting in the waiting room longer than an X amount of time. Well, that takes the burden off us as individuals to make the determination of which patients can wait longer, because those decisions could be unconsciously influenced by the patient's race or age or their appearance of socioeconomic level, etc. For providers, that means practicing evidence-based medicine. And of course, it's really important that we speak up and shed light on policies that might unintentionally lead to disparities. And, Kathy and I, as we were looking over the slide deck, we both agreed that this is our last point, is really the most important. So it is, who are your friends and families? The most important predictor of the unconscious attitudes that we possess or the most important predictor of the unconscious attitudes we possess are our friends, our family, the people that we surround ourselves with. So let's take a social inventory. Who is missing from my social circle? The neural connections between our associations get stronger as we take in more information that actually confirm our biases. So by changing what we choose to expose ourselves to, and it could also be the kinds of movies and the media that we consume also, by seeking out experiences that go outside of our automatic biases, we can disrupt these physical connections in our brains, or at least make an attempt to weaken them. So typically, we tend to see people like ourselves as individuals, and we see people who are different from us as this big old homogeneous group out there. And so counter stereotypical examples can change this thinking by helping our brains not rely on these shortcuts that stereotypes provide. When we see people who challenge these stereotypes about their identity groups, we then begin to realize that not everybody fits into those stereotypes. There is this wonderful TED Talk by Nigerian author Chimamanda Adichie. It's called The Danger of a Single Story. It's about 20 minutes long. It illustrates how if we only hear a single story about another person or a country, we really risk making critical misunderstandings. So if you have an opportunity, I recommend pulling up that TED Talk. It's by Nigerian author Chimamanda Adichie, and I can put that in the chat so you can look it up. Research shows, oh, there we go. Thank you, Naiboni. Research shows that limited exposure to people who are different than us can increase the likelihood that we will rely on these stereotypes rather than our own experience to make judgments about other people. Also, when our social circles are limited, that can decrease our empathy and positive emotion towards towards others. So this is why the research shows that time and time again, having meaningful contact with different groups is one of the best ways to reduce implicit bias. So this is good news. One of the key ways that we can reduce implicit bias is for us to go out and make new friends and expand our social circles. Kathy, did you want to say a word about social inventory?
Yes. Again, going back to the IAT, when I found out about the bias that I have naturally towards Christianity, it makes me think I need to know more about the Muslim faith. I'd like to know more about that. I also had another experience when I was teaching a diversity class for some at one of the military bases here, and in the course of the conversation, it was brought up about gay coworkers, and someone made the common statement, "I don't have a problem with gay people. I just wish they wouldn't flaunt it at work." That I've heard that over and over again, and I've always wondered how to help them see it differently, and through some sort of channeling of some great idea that I don't know where it came from, I challenged the group to go back to their offices and remove all of their pictures of their families, their spouses, if somebody asked them about what they did over the weekend, not to talk about it, to change the subject, to literally keep their total life outside of work out of their conversation in the office. Now, I had a class of about 15, but I had one person who took me really seriously and did that. And every day he would email me and tell me new awareness that he had about that, about how hard it was to not talk about his life. And this was during a time, of course, when it was the no, what do they say, don't ask, don't tell. So so he was fully aware of the dynamics around gay people, especially in the military. And anyway, so he said how that one thing really changed his way of looking at gay people, and in the course of it, he realized that there was a gay person, a civilian worker in working in his office, and he just said, I decided I just really needed to reach out and make sure he felt safe and that I was his ally. And it made me feel really good because it was something that oftentimes doesn't happen. He later said he never would consciously ever be able to think that people were flaunting their gayness simply by talking about their families ever again. And I think that's what happens is once you bring your unconscious to the surface, it won't go back. And we can go, we can continue forward.
Thanks, Kathy. And I want to show you this next slide. A lot of the curriculum content from today's session was taken from the Kieran Institute for the Study of Race and Ethnicity. They have a 4-module class on implicit bias. It is excellent. So please go on here and take this class if this topic is something you want to learn more about. And here are the sources from our talk today. I am going to, we have about 10 minutes. So I am actually going to see if I can queue up the danger. It's a shortened version of the danger of a single story. Can you all see this? Yes, great. All right, so I'm gonna play it. It's 4 minutes and I have it sped up just a little bit in case we had time. Here we go.
As Nigerian family. My father.
Oh, okay.
I come from a conventional middle-class Nigerian family. My father was a professor. My mother was an administrator. And so we had, as was the norm, living domestic help who would often come from nearby rural villages. So the year I turned 8, we got a new houseboy. His name was Fide. The only thing my mother told us about him was that his family was very poor. My mother sent yams and rice and old clothes to his family. And when I didn't finish my dinner, my mother would say, "Finish your food. Don't you know people like Fide's family have nothing?" So I felt enormous pity for Fide's family. Then one Saturday, we went to his village to visit. And his mother showed us a beautifully patterned basket made of dyed raffia that his brother had made. I was startled. It had not occurred to me that anybody in his family could actually make something. All I had heard about them was how poor they were, so that it had become impossible for me to see them as anything else but poor. Their poverty was my single story of them. Years later, I thought about this when I left Nigeria to go to university in the United States. I was 19. My American roommate was shocked by me. She asked where I had learned to speak English so well and was confused when I said that Nigeria happened to have English as its official language. She asked if she could listen to what she called my tribal music and was consequently very disappointed when I produced my tape of Mariah Carey. She assumed that I did not know how to use a stove. What struck me was this: she had felt sorry for me even before she saw me. Her default position toward me as an African was a kind of patronizing, well-meaning pity. My roommate had a single story of Africa, a single story of catastrophe. In this single story, there was no possibility of Africans being similar to her in any way, no possibility of feelings more complex than pity, no possibility of a connection as human equals. So that is how to create a single story. Show a people as one thing, as only one thing, over and over again, and that is what they become. It is impossible to talk about the single story without talking about power. There is a word, an Igbo word, that I think about whenever I think about the power structures of the world, and it is Nkali. It's a noun that loosely translates to be greater than another. Like our economic and political worlds, stories too are defined by the principle of Nkali. How they are told, who tells them, when they are told, how many stories are told, are really dependent on power. Power is the ability not just to tell the story of another person, but to make it the definitive story of that person. The Palestinian poet Mourid Barghouti writes that if you want to dispossess a people, the simplest way to do it is to tell their story and to start with secondly. Start the story with the arrows of the Native Americans and not with the arrival of the British, and you have an entirely different story. Start the story with the failure of the African state and not with the colonial creation of the African state, and you have an entirely different story.
So thank you. I'm glad we had some time to show that video. And Nyaboni says, listening to the talk again reminds me of the recent movie Wakanda and what people took away. It was so surprising. Nyaboni, why don't you unmute and tell us more?
I don't know, I just remember, how people, like some people didn't even know much about Africa, and they really believed that Wakanda was a true place. And so it was just interesting to me how gullible people are and how much information they don't know, or, just kind of talking about the aligning with what we talked about today as far as how we go off of little knowledge, and how sometimes we don't even have a desire to go and find out more information, but then just kind of take and run with what is given, if that makes sense.
Mm-hmm. Yeah. And, so I hopefully the biggest takeaway from today's session is that going out of ourselves to go seek the other, go get watch movies that we don't normally watch, or seek friendships or acquaintances outside of our immediate social circles, so that we can change the implicit biases that we have, and challenging ourselves to do that. So thank you very much for your attention today. Here is my contact information and our website. If you have any questions, I will, our session today is done, but I will stay on for a few more minutes in case people have questions. Thank you, Diana. Thank you, Jenna.